Abdominoplasty is a very effective operation. The question is it the right one for your tummy? Patients need to consider there always is a scar associated with an abdominoplasty. Some women get shorter scars, others have longer scars, but the scars are typically well worth the change in your lower abdomen. Many women present with muscle separation or bulging in the lower abdomen. This frequently can be a result of childbearing, but can occur with weight changes and activities. Unfortunately, you are unable to exercise these muscles back together, but I certainly can bring them back together for you during the operation. Women always ask about the stretch marks. We can remove the stretch marks between the umbilicus or belly button all the way down to the pubic area. We just cut them off. Unfortunately, there's no other way to remove the stretch marks in a predictable fashion. The belly button or umbilicus. What do we do with that? Well, actually, we just leave yours in place and turn it into an island. And then I move all of the abdominal skin down, much like a window shade, and make a new hole to bring your very own belly button out in the very location that you started. Abdominoplasty, like all procedures, has its limitations. Certainly, that lower abdominal roll that gets in the way of exercising will be gone. However, we don't consider this a weight loss operation. It may help you to exercise more comfortably or freely following the procedure. Though I operate on the muscle, resting muscle tone and resting muscle strength does not change. Again, even though the position of the muscle has been changed, follow-up exercising is encouraged and will produce even better post-surgical outcomes. Some of the stretch marks will be removed, as I've discussed. Between your belly button and pubic area, all those stretch marks can be gone. However, some of the stretch marks out to the flank will be repositioned but won't entirely be removed. And finally, there are some tissues that abdominoplasty does not operate on. That would include bone. The hip bones and the shape of the lower back will be unchanged with abdominoplasty surgery. Even the flanks, though wistfully thinking it will be improved, I don't encourage patients to expect a change there unless we incorporate other procedures, for instance, liposuction. We can talk about that at another time. For you, I suggest if you're contemplating abdominoplasty surgery, tummy tuck, come on in. Let's have a conversation following an exam and see whether the goals that you have in mind can be achieved with this very effective operation.